What's up, you guys? This is your boy Miguel giving you your daily dose of radiation. Today's video we're covering how to work around post-reduction equipment, casting, and other tools they use when post-reduction. So, to give you context, I am an X-ray tech. I work night shift, 7 on, 7 off. I work a lot of overtime, so I do dabble in day shift. So essentially, there's several things you have to be aware of. For post-reduction, if you aren't aware, that's usually something's broken, the doctor goes and adjusts it, and it can either be you're shooting it when he adjusts it and there's no cast, and you shoot usually AP and lateral. There's when he puts a cast over the patient, you'll have to shoot sometimes before they put the cast and after you put the cast. Be aware with casting, you have to adjust your technique. Usually there's like a cast cart in the room. If it's small, you kind of have to work around that. Mostly you have to lead and hold the board and stuff, because or some of the nurses will hold the patient's arm or whatever's broken so they can come and check your portable to see the placement of the post-reduction. That's something you have to be aware of. Occasionally, let's say there's something with their hand or tendon is broken. There's this machine that holds the arm up at a certain angle. Let's say usually it's for your forearm is broken. They have this thing where each finger is being held up by little plastics and it holds up like this. So usually you'll have to shoot and there's a metal tube behind it. So usually what happens is you can get you get an AP arm, or sometimes it's a PA depending how it's holding, so you just have to document it. And the lateral, it's kind of hard to get the lateral because of the metal tube that's kind of behind. It's almost like an IV pole. So usually, depending on where it's broken, if it's just an upper break, usually you can include the most amount of forearm and just document that you weren't able to get the rest of the forearm because of the way the position's the way the position's body is hanging and stuff like that. And usually the rats are okay with that. Sometimes patient breaks their ankle and stuff, and they put them in a boot. So that one, usually you want to get the shots before they put it on, because once they put it on, you could get a good AP, but on the lateral, because of the metal and stuff, you can't. Sometimes they come in it almost look like a saw torture device where it has pins and needles holding on this, a giant little box. That one too will show a lot of artifacts, but there ain't nothing you can do about that. Yeah, it's been your boy Miguel. See you on the next one.